It is common to have nausea and vomiting in pregnancy. About 30 to 50% of pregnancies have nausea, vomiting. Usually it's in a mild form with minimal dehydration, minimal weight loss. The significant type of nausea, vomiting is hyperemesis, where it's about 3% of the time, and it has significant weight loss, dehydration, where you have to be hospitalized sometimes for IV supplementation. There are causes of nausea and vomiting in pregnancy. Most of the time, it is due to the elevated hormone levels in early pregnancy. Other causes include psychological or emotional stress. Sometimes there's medical conditions that cause that. Women in their first pregnancies are more likely to have nausea, vomiting. Diets that are higher in fat and sugar cause nausea and vomiting also. Usually, nausea and vomiting does not affect the outcome of the pregnancy or the baby. It will, however, cause problems if the mom gets very dehydrated, if she has electrolyte imbalances or loses a significant amount of weight. We like women to intervene early and come see us in the office so that we can try to prevent the hyperemesis or the significant nausea and vomiting. The preventative measures that help nausea and vomiting in pregnancy include eating a diet that is low in sugar and fat to help the food digest a little bit early. Eat small meals throughout the day. I always recommend to my patients eat breakfast, snack, lunch, snack, dinner, snack, so that you're not getting your belly really full and you won't get a lot of acid reflux. You also try to do a very bland diet so that you're not eating a lot of spicy foods, things that might really upset the stomach. You can eat all day long. I call it grazing. If you just graze all day long, most of the time your blood sugar levels stay steady, and when the blood sugar levels do not drop, you actually have less nausea. Over-the-counter medicines for nausea and vomiting work very well for the majority of women if diet does not work. Those include B6 vitamin, Dramamine, Unisom. There's actually also a prescription medication that's actually new out in the market. It's called Diclegis, and that works really well, which is actually the combination of the B6 and the Unisom together. In addition to over-the-counter medications for nausea and vomiting in pregnancy, we do recommend, if you need something stronger than those, that you do come see us in the office, and we will discuss medications that we feel safe. If you have a lot of reflux with your nausea and vomiting, we can give the H2 blockers, Zantac, Pepcid, Tagamet, and then if something is really bad and you're having a really hard time, there are prescription medications like Nexium and Protonix.